welcome to episode 2 of movement therapy. Today we're going to have a little bit more of a focus from like our roots up. We're going to get everything mobilized all through there today. I will get my sound sorted so I don't sound like I'm in a tunnel, but you're going to have to bear with me for another episode. I thought you'd do a better job having another go at it, and then I'll fix my sound next week. So we're going to start off the same way that we usually do, and then we're going to do a metric. So we're going to come down to the floor, feet hip width apart, laying down, arms open. And from here, we just want to let both of our knees come side to side. And just like lower your breath. It's just some steady, easy breathing. Now, there's a couple of requisites in this class. And those requisites are that you don't move in pain. You follow along what I do. So, as you can see, I'm now swinging my leg across. And you only ask your body where it wants to go. I have a lot of hypermobility, meaning I move a lot. And sometimes you might find that that's a bit too much for you. So make sure you find your movement bubble and go to there. We're going to flip into the floors, hands under your shoulders and knees under your hips. And we're going to work in a cat-cow here. Just lightly and gently moving our spine, tucking your chin and opening it up if that's available to you as well. Excellent. Now, we're going to get into our metric straight away today. So, what is our metric? Well, we want to test our head and shoulders, right? So we're going to see how our neck feels. So we're going to take our chin to our chest and see if there's any tension in around our neck. Or we're going to push our head as far back as it goes and see where we feel that strain or tension. And then your other test, and you might want to do this in front of a mirror or in front of someone who might be able to see, but I also want you to feel how easy it is for you to get your hands above your head. And a couple of things that you want to watch out for here. If you're getting your hands above your head, does your back need to arch to get them up that high? Maybe your ribs need to pop out as well. So what is the quality and how far can you go when everything is stable and still underneath you? And those are our metrics or our measures today that we're going to come back to in just a little while. But we're going to come back to our all fours position. And if you were with me last time, we did a thread the needle and reach. We're going to continue this movement today, and we're going to do it in quite a few different ways. But essentially, our hands are under our shoulders, our knees are under our hips. And we're going to start with the left hand. I'm going to reach our left hand under as far as it wants to go, threading your hand, and maybe even your head through. And then we're going to come up and rotate. Now, we want to move our hips a little as we rotate, reach our fingers above us, not around, and then we're going to repeat again. So we can under, up and rotate, reach. Now I want you to fall into a steady rhythm here. We're going to go for a few more times. And you might feel like you've done those little push-ups on the other arm, but don't worry, we'll keep soon. Excellent. We are going to change hands now. So we're going to flip over, reach the right hand through as far as it wants to go, and then coming up, reach and rotate. The beautiful thing about a lot of the movements that we're doing is that you can add these into any part of your day or any part of your daily routine, particularly if there's something that you feel really works for your body. But you can hear my hair walking around the workplace. Alright. Now, if at any stage you need what I call wrist relief, go into that. Just take some pressure off those wrists. Because you might feel those today, and they're a big part of our neck and shoulders as well. So, this next part is we're going to take our hands open. So we're going to go back to leaning on that right hand. This time we're also going to stagger our left knee forward. Then we're going to thread the needle. It's going to feel a lot different this time. Push over and reach. Focus on your breath and try to replicate the movement in your own movement bubble. meaning however far you can go. Now stay on that right arm. Make it switch your legs. So the right leg comes forward, you still reach your through. Now that one really limited my range of motion, and I can definitely feel it in my wrist. So be careful if it's there that you can go to, excellent. But that can really stretch out those wrists. Turn here. And last. Excellent. So taking that left hand, stacking your knees back to neutral. I'm going to do a couple here first. Again, noticing just what's happening in your body. Not diagnosing anything. Maybe just try and figure out if you feel sensation more on one side than the other, or if it's pretty even. And then maybe just saving that for next time you do a class. Excellent. We're going to stagger the right knee forward first. Right knee forward. Reaching through and go. Now, I don't know about you. It's nice and warmish here. So I'm sweating. But getting that blood flow moving is exactly what we want to do here. And then stagger those legs, change again. Keeping the left hand forward. Now I've got left leg forward as well. Oh yeah, this is the one where that really limits that range of motion for me. Now, at any stage, if that's hurting your wrist, you just flick it back to a normal position. And last one. Amazing. Let's come down, sit however you feel comfortable, and pop yourself into that wrist relief. Whew. Feeling those. Excellent. This next one now is we're going to get into a bit of neck stretching. Mobilization is probably a better word for it. And if you can sit like I am, great. If you can't sit like I am, cross your legs or sit with your back up against the wall so that your back is supported, okay? And I'm going to come back under here. Now what I'm also going to do is I'm going to take my right hand and I'm going to put it underneath my butt. And what that's going to do is it's going to drop this shoulder down. So what I want you to think about is if you can reach the inside of your ankle, grab it so that your shoulder can get pulled down. You're going to grab the same side of your head and just really gently pull towards the other side of the room and come back. Now, when we're looking at neck stretches, I want you to only really feel about 40 to 50% of a full stretch. You don't want to go too hard or too aggressive here. It's really easy to overstretch, and I want you to feel like you're relaxing, not overstretching. Once you've done 3 or 4 there, I want you to pull your head like you're pulling it back towards your shoulder blade, but in that same direction. So it's like the cranial diagonal. 1 more. And then we're going to pull our head a little bit forward and down to our right chest area, our left chest area, sorry, so you can feel it in the right side of the neck. Now remember, don't overstretch. Don't hold your breath, just let it go, breathe out. And take that hand out of the way. You should feel a little different there. Now put your hand under your butt, or if you can grab your ankle underneath. Excellent. Sitting yourself up nice and tall. And we start just with that direct head tilt. And coming back again. Just that direct head tilt. Let's do a few more here. And again, just taking note of what you feel, where you're feeling it, and any differences you might encounter. Let's take it to our right shoulder and back. I always feel like when I'm doing neck stretches, I want to close my eyes. I don't know why that is or what that is, but if you feel so inclined and you can follow what I'm saying, just close your eyes on it. And now we want to take our head down to our right side chest. 1. Fantastic. Taking that hand out. We're going to stay with our shoulders. So again, you can be kneeling or you can be seated. But what I'm going to do is we're going to do some shoulder circles. But we're going to go super slow. So eyes on me first. You're going to roll your shoulders as far forward as you can in that kind of really awkward shrug. And then try to lift your shoulders up into your earrings or your earlobes. And then pull them down your back. And as low into the socket as they'll go. And we repeat. So we lift. And draw down. Now be really careful that you're not manipulating your ribs. I don't want you to do that. I just want you to manipulate your shoulder blades for now. And back and really onto the side so that you can see. And back. Now once we get to the top, we're going to reverse. We're going to go down. Pull our shoulder blades together. And lift. Now going slower means we're going to turn on some muscles that might be asleep and hopefully just take out some tension from those muscles that are a little bit too awake. Excellent. Wow, you can feel that. You can feel lots of blood flow happening there. Now what we're going to do is now we're going to get our ribs involved. We're going to use our arms to make this a little bigger. So now I want you to think about moving your spine as well as your shoulders. And to create this movement, what we're going to do, intertwine your fingers, push your hands away from your chest, try to push your shoulder blades off your back. And then we're going to come and open. Now you can come to parallel or just outside parallel. And imagine squeezing your shoulder blades together and arching your back. And we're going to repeat. Trying to make yourself into a little ball, and then imagine you're on the Titanic. Fine, Jack. And go again. Really bad turn, sorry. Go. 2 more here. Can you visualize every inch of your spine and your shoulders moving exactly where you want them to, making sure your shoulders don't creep up. You're also trying to pull them back down. Excellent. So some of you will be feeling quite a few things happening in there, which is great. I want you to feel those things. But now we're going to take it down a notch and we're going to open ourselves up with a few stretches. We're going to start with the upper back and then move into the chest to finish. So we've got a really nice child's pose to start. Legs wide, feet together if you can manage it. And you're going to set your hips back. Then you're going to reach your hands forward and put your head on the floor. Now I want this to be an active stretch, not a passive stretch. So watch for the difference. Passive would be me relaxing here and just resting. But I want it to be even more active than that. So I want you to actively lift the insides of your elbows up while pulling your shoulders back towards your hips. And breathe here. Inch your fingertips forward, just inch them forward. To that point where you can feel your shoulders almost being pulled down the side. Take a few more breaths here. And you go any further on these last ones, sending your hips back. Excellent, you can come up from that if you need to. From here, we're going to do really the same thing, but we're going to take it to the side. So right hand comes across the body, and you want to find again that active stretch on the right side. You can be passive and relaxed on the left, but my right arm is up and active. My arm to the roof, fingertips on the side of the roof. Stretching out your side body and your shoulder. Couple of deep breaths here. And then let's take it to the left. So reaching across to the right, thumb goes up, passive on the right side and reaching active left. Focus on your breath. Everywhere else in your body is relaxed, and you've got that little bit of activity happening in your upper body and down your side body. Perfect. Then the last couple of stretches today are going to be for opening your chest as well as a little bit of your spine. So we can come down to our belly. Now we can do, this will take a smaller stretch, this will be a larger stretch. So I'm going to stretch the left chest first. I want you to reach your arm out as far as it feels comfortable. You might already feel a little stretch. Bring your right hand to your chest, about nipple line. Then you want to pull your leg up and push your upper body away so that you feel that stretch. Now your leg might not hit the ground, it might dangle up here. That's fine. As long as you're not getting any back pain here, that's great. But it will also open up your hip. So find a position that feels comfy, stretching out your chest, and you might feel like a press all the way to your right side hip. Take another breath here. Excellent. And then down, reset. My right hand is up as far as it can go. Left hand nice and close to my body. I pull myself away into that stretch. Again, trying to open up this hip as well. So I'm stretching from my left hip to my right shoulder, what we call a sling, a cross-body sling. And just breathe into that there. Last breath here. Can you stretch into it a little deeper? And then just nice and gently bring yourself back to center. I feel like I've got a lot of heat in my shoulders, which feels good. So let's retest where we're at. We've got the first one that we did was our chin to our chest, where I feel like I can just keep going now. I have no tension left in my neck. And then how far back can you go? Oh, that takes better as well. Hopefully yours feels better too. And then let's go arms up. Can you go a little bit further without your belly or your back moving? And while I'm not sure if I can go any further, who knows, while I'm above my head, it feels a little bit more active and a little bit more free than it did before. So I really hope you're getting those same feelings. Please send me your requests for areas of the body that you might like me to focus on for you. Otherwise, I'll see you next time you tune in for another episode. Thank you.